which orients my implant prosthetic. That's it. This is my implant position was. Place the implant. Now I do something called the guided pose interpolation GDR. After doing the GDR, this CBCD goes 3 months. This CBCD goes 6 months. This is how we would restore it in a year's time. So again, another case, patient was complaining of missing, you can say, polar, bone loss. Yeah. So what we had to do was we had to use a graph which is a membrane thing. I do a lot of research also. But a graph which we don't have to use a membrane. Using this case. This is an exact case of anti-digitalization. This is the solid SPM model. This is the CBCT. We superimpose it. We make the planning. I know when exactly my tooth is going to come. This is post grafting. What is the graft which is being taken up or not? This is not planning. This is the guide fabrication. This guide protocol with every system you see. First is the surgical guide which goes in 12 April. So this is the great part I need to use this to make the prints. Treatment of the implant, post implant, so from here to here was analog. We had to do a GDR, and then going ahead everything was digital. So you need to plan your cases in a reverse fashion. It's called as reverse engineering. Implantology is reverse engineering. You just cannot say I have a 4-6 missing and I want to place an implant. No, you cannot do that. So what are tissue supported guides? So patient walks into your clinic and the patient wants maybe upper 6 and lower 6 implants, and that's like, okay, that calls for me a good shopping experience somewhere down the line. Zara ka shopping ka sale lag raha hai and I have got like 12 implant kits, right? So you just send the patient to the CBCT center for a CBCT, and patient comes to the CBCT and then you see, oh, I can only see the bone. Can that be a starting landmark for you guys? Can that be a starting landmark for you guys? You just see a edentulous bone on a CBCT. No, right? You need to plan a denture first. You need to understand where your implants are going to be placed. Moving ahead, you need to plan your implants. So, how to prepare a case for a digital implant before even making an implant placement is important. So, I'm going to tell you how to make a guide for a tissue supported guide for a edentulous case, and this is a workflow protocol which you guys need to follow. So I have a case like this, which is edentulous, bare bone. Do I know where am I going to place my implants prosthetically? No, right? So what I have to do is I have to fabricate a denture and place markers on top of that. Why I have to place the markers? Yeah, you can say it loud. To overlap my edentulous image with the denture, so I exactly know where my central incisors are, where my molars are, where my lateral incisors are, everything. So how am I going to place the implants? Do I need a sinus slip? Do I not need a sinus slip? Everything clean. Middle third of the tooth surface.
इनको किसी को पता नहीं चलना
चाहिए. So what happened was, can you see something wrong in his face? Something is wrong in his face, right? Yeah, you can say loudly. Face is asymmetrical. Okay. This was something old prosthesis which you had done back in 80s. This was called as ring prosthesis. So there used to be two metallic rings and there used to be a bridge, which are also very lovely. Means they have stood the test of the time. I mean, he had done in 80s, and I have removed it maybe 10 years back. So what happened in this situation was this case was medically compromised. I had to be as sure and as safe as possible when I was doing this case. So, as you guys said, right, he had a symmetrical face on a CBC. I see those composite or a zirconia markers on a CBCT, right? What I do is now I can plan my implants. According to age, he would not have stood GBR or